All right, well, welcome everybody. I'm Jeannie Kroll from ATAP, and welcome to the third session of the Aging Pal group. And today I'm going to do just a quick definition again of what assistive technology is, and then I'm going to turn it over to our wonderful facilitator, Andrea Ruth. And just to remind you, and I'm not going to do the full presentation like I did last month. These slides will be in the community forum for you. But I just want to remind you that assistive technology means any item, piece of equipment, or product system. And it really can be anything. And it's defined by what it does in improving and maintaining or increasing functional capabilities of the person versus what the device is. And this is something that you should all take a look at when you can after the session to really see how big assistive technology is. And if you're from the ATAP programs, these are different than the 10 categories that we keep data on. We've expanded these a little bit to really show how big assistive technology is. And oops, and there's a second page. and it really includes, all the environmental controls, those smart speakers, and with accessibility features, the communications technologies, such as the Eloquist or the Eloquist. um, I'm trying to remember the name of that one device, but uh, so that people can talk back and forth, and home modifications and hearing devices, and different types of learning cognitive devices, fall detections, PERS, computers, seating, mobility, all kinds of things. And just also know that the legal definition of assistive technology is inherently broad enough to include all of this technology and more. And with that, I'm going to move it right to Andrea.
Thanks, Jeannie. We are going to move quickly today so that you get the most out of the presentations that you're going to hear. So I just have a couple things I wanted to say at the outset. One, we got a little feedback, which we greatly appreciate after session 2 last time. And we're not going to address that today just because of time, but we will talk about it at session 4. And we want to thank any of you who have feedback for us. Please send us an email. Let us know how this is going for you, any suggestions you have. As I said, the time is tight today, so we're going to hear from 4 states who have collaborative models operating now. And we're hoping that we have a little brief time in between each for questions. If we don't, we will make sure that you have the contact name of the people presenting, name and contact, so that you can call them or email them and get your questions answered. You'll also be invited to put your questions in the community forum or in the chat today. So please go ahead and ask those questions if you can, if we have time, and if not, there are going to be multiple vehicles for you to do that. We want to emphasize today that these are just some examples of the different kinds of collaborations that exist for assistive technology and aging services, organizations, and entities. So we're not saying these are the best of the best, although we'd like to say they're wonderful. But you want to know that we couldn't get all of them presenting today in the short time that we have. So there are other collaborations and collaborative models that we'll talk about some at session 4. And you all know others that exist. And we're glad to hear about those. And we invite you to put things in the community forum about those. Many of these collaborations are having a great impact for older adults as they seek assistive technology in the states and communities. I do a lot of facilitating, so I'm going to do something that I did not tell Jeannie I was going to do, but I invite you to think about this. So there are different ways to listen. There's listening to, listening for. And our brains, I've been doing a lot of research over the last 10 years on brain science. Our brains seek to answer the questions that we're asking, that our brains are asking. So I have a couple questions that you might want to jot down, and I'll put these in the chat. Questions that your brain might be asking as you listen for these presentations to answer the questions. So one could be, how could this collaborative model work in my state? Or you might ask yourself, if we did something like this in our state or community, who would we need to collaborate or partner with? A third question could be something like, how could something like this model help those who are aging and need assistive technology in my state? Or the fourth question might be, if you already consider yourself great collaborators and partners in your particular state, you could ask the question, how could we take this information and improve what we already do? So these questions are what I call a listening screen. And they give you just something to listen for as people are making a presentation. So without further ado, I'd like to briefly introduce our speakers for today. And let me just tell you that the full bios are on the community forum. So if you want to hear a little bit more about who they are, please seek out those bios. Today we're going to hear from Connecticut. We have Arlene Lugo here, Director of the Connecticut Assistive Technology Act program. She's joined by Margie Garundo, I think it's Garundo Marquette, who's the manager of the Bureau of Aging in Connecticut. Then we're going to hear from North Carolina. And from North Carolina, we have the two Tammys. We have Tammy Paraboom, who is an AT specialist with the North Carolina Assistive Technology Program. She is going to be joined by Tammy Koger, who is now the Deputy Director of the Division of Aging, or I had Director of Division of Aging. She can correct us on her title. With the North Carolina Department of Health and Human Services. And what we learned just a minute ago is that Tammy Koger used to be with the AT program in North Carolina. So she's a crossover and has knowledge of both areas. We will also hear from Missouri, my home state, today, and David Baker is here with us as the director of the Missouri Assistive Technology Act program. And he is joined by Christina Scott, who's a senior program specialist with the Bureau of Senior Programs at the Department of Health and Senior Services in Missouri. Our fourth group will be from North Dakota, and we have Mike Chaussee. He's going to correct me if I mispronounce that, but I think it's Mike Chaussee or Mike Chaussee. And he is the executive director of the North Carolina Assistive Technology Act program, the nonprofit that houses the assistive technology program there. And then Nancy Nicholas Meyer, who is the director of the North Dakota Department of Human Services Adult and Aging Services section. So you'll see that each state has an AT Act program person and an aging services entity person presenting. And we're really happy that both partners could be here with us today from each state. All right, so with that, I think we are ready to hear from Connecticut. And if we have time, we will take a few questions afterwards. So you might put your questions in the chat for ease of asking those. All right, so Arlene, Margie, I will turn it over to you.
Great, thank you, Andrea. Hi, everyone. My name is Arlene Lugo. I'm the program director for the Connecticut Tech Act project, and I'm joined by my colleague from the Department of Aging and Disability Services, Margie.
Hi there, Margie Gerendo Marquette. I'm the manager of the Bureau of Aging within our Department of Aging and Disability Services.
Next slide, please. So just to give you some perspective, the Connecticut Tech Act project has been established in Connecticut since 1992. I joined way back in 2006. Our mission is to increase independence and improve the lives of people with disabilities in our state through increased access to assistive technology for all areas of life, for work, for school, for community living. We provide our core ATAP services of AT device demonstrations, AT device lending, reuse or recycling of AT, financial lending, and we also provide technical assistance to organizations who want help with AT services, education and training, and info and assistance, which essentially means anybody who wants help with AT devices or services can reach out to me for assistance. We've always been open to collaborating to meet the needs of a broader range of people in our state. Currently, we have 9 community AT partners that provide the AT services across our state. But some prior collaborations have included working with 2 hospitals, spinal cord injury departments to help their patients learn about AT as they transition and adapt to their new injury and transition back home. We've offered trainings to school systems to help them establish their AT processes. We've improved healthcare outcomes through partnering with the Connecticut Department of Public Health. And we've worked with our state library system to help establish accessible workstations within libraries for our patrons with disabilities and older adults. And then most recently, over the past few years, we've worked closely with our Bureau of Aging. Next slide, please.
So our Bureau of Aging is in the same agency as the Connecticut Tech Act, just a different bureau. So we are Connecticut's designated state unit on aging under the Federal Older Americans Act. So as you may know, each state has a state unit on aging. We just use different names for it. Our Bureau's vision is supporting older adults so they can live longer, healthier lives. And we have state and federally funded programs that support older adults, their families, and caregivers that help people stay at home longer with services and supports in the home and community. So we have a lot of programs. They include senior nutrition, which includes congregate, home-delivered meals, commonly called Meals on Wheels. We have our state health insurance program, also known as SHIP. All states have those. We have respite programs for caregivers, health promotion programs, and so many others. We also have a 3-year state plan on aging, and our goals for that are long-term services and supports, healthy aging, and elder abuse prevention. We collaborate with so many different agencies, including our 5 area agencies on aging in Connecticut, our senior centers, our municipal agents for aging, community providers, and of course, the Tech Act as well. Next slide, please. So the Connecticut Tech Act and the Bureau of Aging had been connected for years before we got to do a project together. So during early COVID, there were CARES Act funds that we received that gave us an opportunity to start a joint project called Stay Connected. And once those funds ended, we looked at the lessons learned. We started looking for funding so we could do the Stay Connected project, but with some updates and improvements. And so there was an opportunity to do this when ARPA Public Health Workforce funds became available. So the Connecticut Tech Act had some funds, the Bureau of Aging had some funds. We decided to pool them and also leverage some Older Americans Act admin funds to make a new project. And really pooling our funds was the only way we felt like we could have a meaningful project work because we each couldn't do it on our own. So we called this new project Bridging the Digital Divide. And then once the funding ended in 2025, we kept looking for ways to sustain the project. So our next few slides have some details on each phase of this joint project, including our newest phase. Next slide, please.
So as Marky stated during COVID back in 2020, we had our first opportunity to really work together through our Aging and Tech Act projects to collaborate and serve older adults 60 and older and adults with disabilities who were experiencing social isolation as a result of COVID. We created Stay Connected, by identifying individuals at risk of social isolation, distributing tablets and hotspots, and providing them with training to help them re-engage with their family, with their friends, with their community, and also connecting to telehealth. We screened nearly 750 individuals, but unfortunately, not everybody was eligible for these services. The social isolation scale that we used forced us to turn applicants away, but also we ended up developing a pretty lengthy wait list. About 75% of the respondents that we screened reported that because of COVID-19, they were socializing less than usual. For those who were eligible and received services, about 85% of them said they were no longer rating themselves as socially isolated or at risk of isolation. So our program worked. We did, well, close to 300 of our residents received AT consultation services. And of that, only about 80 of them went through the full process of getting the assessment, receiving a device, and receiving training. From that smaller group, 80% of them strongly agree that the program helped improve their quality of life. So again, the program worked. But as you can see by the numbers, there were some cons. We had a lengthy waiting list. We couldn't serve everybody. Part of the program also allowed us to collaborate with our Centers for Independent Living, several of our AT partner agencies, and the area agencies on aging. So as I said, there were some pros to it. We helped a lot of people, but there were some cons in that we couldn't serve everybody who really did need the services that we were providing. But we took some of those lessons learned and allowed us to streamline this program and turn it into something new and better. Next slide, please. So the new program that we created in October of 2022, through leveraging the funds that Margie mentioned, was Bridging the Digital Divide. And we really took the feedback from the people who participated in running Stay Connected to develop this new version of the program. You know, through this leveraging of funding, we agreed that we would work with 2 of our community AT partners. Although the CILs and area agencies on aging benefited from this program and had some input into it, we kind of narrowed down who was running the program and providing those services. So streamlining the process and having a very robust data collection process, we were able to empower individuals, again, 18 and older with disabilities or older adults who are 60 and older, by equipping them with technology, skills, and support to fully participate in our digital society. So while Stay Connected focused on providing tablets, our Bridging the Digital Divide program was a little bit broader. First of all, we focused on what technology does the person have in hand? Do they have their own smartphone? Do they have their own tablets or laptops? If not, if they did, we trained them on it. If not, we provided it to them. But we also provided a wider range of technology, so including laptops, tablets, and smartphones. We also did some smart home technology like Google Home and Alexa. We did some smart medical devices as well, like smart blood pressure monitoring. And we serve people that range from ages of 18 well into their 90s. I mean, we had the majority of the people I would say that we served were 60 and up. We also did continue to try to measure social isolation. We used the UCLA 3-question scale instead, but we didn't use it to determine eligibility. So it allowed us to serve a much larger number of our Connecticut residents. So in this program, for the 2.5 to 3 years that we provided it, we served over 850 Connecticut residents. And we also trained staff at over 70 organizations to help them better support this same population. Our focus was on built-in accessibility features, but we also had a new focus of sharing the pros and cautions of artificial intelligence with the consumer so they could be aware of online safety. So these were some important components of this new iteration. Unfortunately, funding ran dry, so we did have to close the program in June of 2025. Next slide, please.
So as Arlene mentioned, that unfortunately things were ending in 2025. We were looking everywhere for funding. Anybody who would listen to our pitch, we were pitching it. Even when Arlene talked about the AI piece, that was as a result of leveraging some AI funds that our state legislature had slated for education. So we added that as an AI education and safety component to the BDD program at the very end. So fortunately, another opportunity came during our state's application process for the Rural Health Transformation Funds last fall. And our state, like all other states, applied for and received these funds. And in Connecticut, it's been a collaboration of about a dozen state agencies with various projects seeking to improve rural health in Connecticut. So our department is part of this grant. We receive funds to do Bridging the Digital Divide under this grant and also expand our evidence-based exercise program. So we're ramping up now to restart BDD and serving older adults and individuals with disabilities in rural Eastern and Western Connecticut through 2030. So we know that individuals in rural communities face unique challenges, including access. And with BDD, we look to reduce barriers to access. We want to expand digital access and literacy. And this is a great opportunity to do it. And with our same AT partners joining us for this last phase of the project, we'll be able to continue to provide devices, hotspots, technology training to support telehealth use and social connection. And it'll look a lot like our previous BDD as well, just in specific areas of the state. So the Connecticut Tech Act is collaborating with the Bureau of Aging to support participation in virtual programs for older adults, including exercise programs under this grant. So our bureau is going to choose a new virtual platform with online educational programs, wellness, and engagement. And then the AT partners are going to help support folks who need help accessing and using the platform. Next slide, please. So we have our partnership really between the Connecticut Tech Act and the Bureau of Aging works for a number of reasons. We have mission alignment. The Tech Act and the Bureau are in the same agency, just two different bureaus with the same broad mission to maximize opportunities for the independence and well-being of people with disabilities and older adults in Connecticut. And it helps that Arlene and I are in the same agency with the same commissioner, but I'd like to think that we'd be partners even if we weren't. Our department has core areas. We align in the areas of independent living and accessibility. And a lot of people benefit from our partnership, older adults, individuals with disabilities, their families and caregivers, state and local partners. We've been able to expand our partnership opportunities and connections for both of us on both sides. Aging is better connected to AT partners and technology in general through our partnership. Connecticut Tech Act is better connected to our aging partners, including the area agencies on aging and senior centers. We have better cross referrals and support. And before I turn it back to Arlene to wrap up for us, I did want to share that Arlene is such a joy to work with. It helps to have people and collaborators like Arlene and the AT partners who are so passionate about this and so wonderful to work with. And, we recognize that Arlene and the AT folks are the experts in what they do. They provide a service that benefits our consumers. And we've really been here in a supportive role, offering what we can. I think we've really supported each other. It's the stronger together approach. So, Arlene, I'll pass it to you.
That was not in our talking points. Thank you.
It was not.
So another reason why this works, I think, although the Tech Act project received some funding, we didn't have enough to stand up a brand new program like Bridging the Digital Divide. And when we communicated with Margie, when I communicated with Margie, they had funding, but they didn't have a person to lead the project. So it really worked out that, we could leverage our funds. I could provide the in-kind leadership. Margie could provide some funding to really build a program that has really worked. In addition to mission alignment, many older adults have functional barriers. They may not identify as having disabilities, but we can help reduce those barriers and improve their functioning, independence, and being safe at home. When we first approached our AT providers, some of them were hesitant. They were like, this is not our population. but now they realize it is, and that older adults can truly benefit from AT. So they've developed their expertise and have brought in their, the population that they serve. And now moving into the rural towns. We continue to seek more opportunities because we really want to serve statewide. And I don't know how we're doing on time, Andrea. I do want to share just at least one anecdote. We do have time. Okay. So, you've heard from us, but these are some anecdotes that we've collected, and we did ask our AT partner agencies as they worked with individuals to share as much as they can, because we know that, it's great to talk about the program, but here's a story of a person named Brian who was 59 years old and had a rare bilateral stroke that left him unable to walk, severely limited coordination in both hands. He was living in a nursing home and was becoming increasingly isolated because he wasn't able to use his phone or connect with his family. And he spent most of his time in bed and was cut off from regular communication. So his sense of loneliness was really deepening. To help bridge the gap, the BDD team installed Alexa on his phone, connected it to the Echo Show, set it up, taught him how to use voice commands and to make and receive phone calls without needing to use his hands. The drop-in feature allowed his family to connect with him instantly via video chat, providing consistent emotional support and companionship. So beyond staying connected, he was able to use Alexa to set reminders for his daily therapy, to access education and motivational content from his bedside. And then using the voice command actually helped him with his speech and his fine motor coordination, demonstrating how the program support not only connects, but also helps with rehabilitation and independence. So that was an excellent story. And then one more really quickly. Actually, we have a former BDD supervisor on the call. Hi, Miriam, who had sent me this email about a consumer who receives an iPad. It was a couple, an older couple who had iPhones that they were using only to make phone calls and send text messages. So the digital divide coordinator set up an iPad for the two of them. He created their Apple accounts, helped to accommodate their age-related vision and hearing loss, and set it up with their MyChart for telehealth, FaceTime for calls, and so on. So she received an email from them saying how much they wanted to thank the digital divide coordinator for his time. She said, "This is a fabulous program for seniors. Your easygoing and friendly personality made the whole process enjoyable. You took the time to answer questions and made sure we understood the program, and ultimately to use the tablet. The world needs more people like you who want to readily give more than they receive. You're an asset to our program." And that was from John and Nancy H. Which, we love getting these kind of emails. So it just was a testament to the work that our AT providers, AT partners provided. So that's it for us. Thank you all so much. We appreciate your time, and we hope that you found this information helpful.
Thank you, Arlene, and thank you, Margie. Great program, great partnership. We didn't
Andrea?
get any. Oh, yes, sorry.
We have one question.
Oh, I didn't see it. Okay, go ahead.
No, it's okay. I didn't either until just now. For Arlene, who provided the AT screenings and training for all of those people, and who did you train to help with this?
So because the Tech Act project offers our AT program in Connecticut through contracted AT partner agencies in the community, we were able to request applications from that smaller group of entities to ask them who wanted to help us provide these services. So we had two AT partners, UCP of Eastern Connecticut and the NEAT Center, who stepped up and said, yes, we want to do this. So they're already AT experts that already work with people with disabilities. So through the public health workforce funding, they were able to hire what we call digital divide coordinators to go out to people's homes, assess them. They weren't receiving comprehensive AT evaluations, but they met with them to see what type of technology they had and what they would need to match them to the right device, provide that training, show them how to use it, provide the online safety and AI education as well, and then provide a device if they needed it through this program.
Great. Thank you, Arlene. And such creative things that you all did, like the AI money, the money for safety around AI, and you took advantage of that. So Thank you for giving some of our listeners, our participants, those kinds of ideas today. I'm going to go on because we are getting close on time. So, North Carolina is next. And for North Carolina, again, we have the Team Tammy, and Tammy Paraboom and Tammy Koger. So, I'm going to turn it over to you two and let you share your collaborative model with us.
I'm Tammy Paraboom, and I am an assistive technologist in the Charlotte office of the North Carolina Assistive Technology Program. We have 9 centers throughout North Carolina, and each one has an assistive technologist.
Hey, good afternoon, everybody. I'm Tammy Koger, and I'm the Director for the Division of Aging. Recently moved into that role, so totally understand why the title was not correct. So I've been the Director of Aging for about a week and a half. Moved into that role from the deputy position that I started in October. And then prior to that, I was the ATAP Director for the state of North Carolina for a little over 18 years. So you have me today versus having one of our staff with the Division of Aging, Jessalyn Bridges, who was very instrumental in our work prior to me coming over to the Division of Aging. But unfortunately, Jessalyn is out today, so I am kind of filling in for her, and hopefully I can do her a little justice. And I think we can go to the next slide, right? So I'll kind of start us out just because I have the unique perspective of being with the ATAC program, doing our work with COVID and under the ARPA funds that we received, and then also moving into this role with the Division of Aging. So just a little history, the relationship between the Assistive Technology Program and the Division of Aging actually prior to COVID was a little fragmented. We did some work, but it wasn't very collaborative, honestly, prior to COVID. And the relationship, just finding the right people to talk to and trying to determine the best paths were a little, inconsistent. So what happened during COVID, and I always like to look at the positives during COVID, right? And one of the things that came out of that is, of course, many of the states received ARPA funding, and the Assistive Technology Act program was not necessarily listed as one of the receivers for the ARPA funds, but the ATAC programs were listed as a collaborator and was strongly encouraged for other agencies who were receiving ARPA funds to collaborate with the ATAC programs. And so when those funds came out, Jessalyn Bridges with the Division of Aging contacted us at the ATAC program and said, hey, we've got these funds. Let's talk about how we can work together to meet the needs. And of course, at that time, we were also working with individuals who social isolation was huge. It kind of act like that was a new term at that time. It just became more prevalent at that time. And the whole world started noticing what social isolation was and what cutting off access to family and friends did for our individuals, specifically in long-term care facilities. So with the ARPA funds, what we decided to do initially was to really focus on social isolation, and very similar to the Connecticut digital program that they just discussed, we were like, we need to get tablets into the hands of individuals in long-term care facilities. We need to train individuals on those remotely, of course, because we could not go into the facilities. And we need to help them become more connected with their family. So we had the great idea that we were going to purchase tablets and we were going to do this training. And we were going to drop off tablets at long-term care facilities and provide this remote training. What we quickly learned, of course, is that individuals needed more than remote training, as well as many of the caregivers in the facilities also needed that training. So we looked at, well, how do we do that training? How do we, provide more assistance to them? And so we looked at doing webinars and more online instructions for the tablets themselves. In addition, we also took the opportunity to really look at our rural populations across North Carolina, and specifically individuals that were 60 plus, and what assistive technology devices might they need in order to remain as independent as possible in their home and community. And so the second part of the initial ARPA funds was to do those assessments on individuals across the state. And the primary focus was, again, in a lot of our rural populations that were very limited on the resources. We provided the assessments, we identified the technology needed, and then we quickly learned that, well, who's going to buy any of the products that might be needed? And so that became a challenge. And about that time, we also had the opportunity to apply for a second ARPA grant. And with the second ARPA grant, we decided to focus on thank you for doing that. I apologize. Good slide. We focused on getting those devices actually for the individuals that we had originally done the assessments on. So the individuals who had the assessments, and we identified types of assistive technology that would be beneficial for them in their home and community. Now we were actually able to purchase many of those devices and help them get them, and then also provide the training on those devices. We identified through the ATAP program, we were identifying individuals through the senior centers, through the area agencies on aging, through the Services for the Blind, our program, Division of Services for the Blind, and finding they also had many social workers that were going out, and we were able to find individuals through the social work program through DSB, or Services for the Blind, as well. And I think I'm going to stop at that point because I believe Tammy has all the great numbers and all the great work that was done.
Next slide, please. So with this grant, we were able to serve 228 individuals. Most of them were over the age of 55, and we provided the consultations, assessments, trainings, and the technical assistance. And then we were able to serve 163 individuals under Access, and Access was the one that was able to provide the devices for them. We purchased 907 devices, totaling approximately $395,000. Next slide, please. So that brings us to what's happening now. One of the big benefits of both of these grants was the collaboration with the different agencies, and some of that, in all honesty, was the introductions and meeting the person. And then since then, we've been following through more on our regional levels. As I said before, we have 9 centers throughout North Carolina. And so each center, how they respond and how they work with the different agencies is a little bit different, but it includes having tables at a senior fair. And typically what that looks like is, the agency has the senior fair. NCATP comes with a table, and you bring all demonstrations of all different kinds of things, possibly an Alexa with lights, possibly like a dustpan with an upright handle. Some things that are very low tech, some things that are much higher tech. Then we also have done falls prevention presentations. I know a couple of those were done with the local area of aging. And then we've also done demonstrations at the senior centers. And in one case, I had a group from a senior center come and tour my center, which in my case, it made it much easier because I just had to show them my center as opposed to trying to take everything to their center. And we have 3 of our centers we've identified as smart home centers. And so we've put more of our financial resources into buying smart home devices, and Charlotte is one of those. And so I was very easily able to show the participants the different things from the smart homes. Also, some of my colleagues have presented at the AAA conferences. And then all of those lead to individual demonstrations and loans, whether someone stops at the table and says, well, I'm interested in blah, blah, blah. Oh, yes, I'd be happy to show you that. Let's set up a time. And so we've been able to do the demonstrations and loans.
And so just a little bit more about that. So Tammy and the ATAC program is doing a lot at the grassroots level, working with the senior centers and the AAAs. And just to let you know, in North Carolina, the Division of Aging, of course, we provide a range of services and funding for a range of services. And then we collaborate with partners across the state through the AAAs and senior centers to provide those services. And so the ATAC programs and the senior centers and the AAAs are really those boots on the ground, reaching the needs and the individuals in their local areas. More from a systemic point of view and systems change is we are currently at the division level are also looking at how we can implement assistive technology and in support of our aging in place initiatives and supporting individuals to age in their homes, looking at universal design principles, aging in place, the use of assistive technology and remote supports, and how individuals can stay in their home as well as support caregivers in their home. So we're hopeful. The other thing I forgot to mention is also during this time within the Division of Aging, there was also a strong focus on digital equity. And so working with NC State and partners across the state, really focusing on digital access and equity for individuals who are in the 60 and older category, getting resources for them, getting the broadband in place. Very happy to say that North Carolina was able to move forward with a lot of that work, even though the Digital Equity and Navigator project that we worked within the division unfortunately did not receive additional funding to continue that project. Some of those efforts are continuing through the university systems and through Department of Information Technology at the state level. So that's some of the more of the systemic or systems change efforts that we are working on now within North Carolina. And I believe, do we have another slide, Tammy? I'm not sure.
I think that's it.
I think that's it. Okay, we may have went really fast. So.
You guys did great, and you caught us up on our timeline. So I don't think we have any questions, but
One
Jeannie,
question.
yeah, I'm having trouble seeing the questions
Oh,
for some
that's
reason.
okay. That's why we're a team. And Omar says, hopefully I'm pronouncing your name correctly, as the aging population grows rapidly, many families and care systems struggle to coordinate daily support for older adults. How do state AT programs see the role of AI-driven assistive technology in supporting independence and daily care coordination for older adults in the near future?
Um, well, I think some of it's on an individual basis as far as what their comfort level is with the AI. I also think some of it is on what the individual needs as far as whether it's organizing schedules of appointments or is it organizing caregivers, which caregiver is when, or is it organizing medication management?
And I think Marty had reminded me that this is a pretty big topic. So we may want to talk about this in a later session, get a few more states to weigh in on what they're doing around AI. So thank you, Tammy, for answering that. And I think we'll put that on our parking lot page. Okay. All right, thank you, Tammy and Tammy. Very great. So now we're going to hear from Missouri, and David Baker is here with us, and also Christina Scott from Missouri. So I'm going to turn it over to you two.
All right. Well, thank you very much. And Jeannie, if you want to go one more slide. All right, one more. There we go. Okay, so we're going to kind of set the stage here a little bit. Just as a quick reminder, wanted to make sure that everybody was able to recognize the Missouri flag, so I put that in earlier. So if that ever comes up in trivia, you will now have that forever embedded in your minds. So, but again, I'm David Baker. I'm the director of Missouri Assistive Technology, and Arlene kind of touched on this a little bit earlier, but I know we're all kind of coming from different locations. So we too are the Tech Act program, only in Missouri, and our focus is always on increasing access to devices and services so that people can live more independently. And we do similar activities as to all of our colleagues across the United States, with focusing in on device demonstrations, reutilization, financial loan, and other services that are commonly done by Tech Act programs across the United States. But I'll hand it over to Christina because I really want her to kind of explain our Department of Health and Senior Services and our Bureau of Aging and kind of put that into the context of our discussion here.
Thanks, David. If you want to go to the next slide there, thank you. I am Christina Scott with the Missouri Department of Health and Senior Services. Within Department of Health and Senior Services, we have several different divisions, our public health division and things like that. I am a part of the Division of Senior and Disability Services, and that further breaks down to home and community-based services, our adult protective services programs, a long-term care ombudsman, and other things that are under DSDS. And then I am part of the Bureau of Senior Programs, which is our SUA, our Missouri State Unit on Aging. So as other states have already mentioned, we are that state unit that is the pass-through entity for Older Americans Act funds that flow through us and go out to the area agencies on aging, and all those fund services that are associated with AAAs that we know of, like senior nutrition and senior centers and things like that. We at the Bureau of Senior Programs also have some other federal programs living with us, like CSEP, which is for senior employment, and MIPA, which is Medicare support for low-income folks. And then we have several state programs that are also administered through us at the Bureau of Senior Programs. We have volunteer recruitment, naturalization, senior independent living programs, and various other things, including the Missouri Caregiver Program, which is a state-funded program to support caregivers of people living with dementia, and something that we're going to talk a little more about later.
Correct. All right. Well, thank you. And so, as I was kind of thinking about putting these slides together, if we move to the next slide, and I started kind of thinking about us as Missouri Assistive Technology, and then the agency in state government that Christina works for, and other relationships that we have with entities across the state of Missouri. And when I kind of zoomed out, it's obvious that we have this shared mission here, and that's independence and aging in place. And so place is missing from the title there of the slide, but that should say independence and aging in place. So both organizations obviously have a focus in supporting people to be able to live independently as long as they possibly can. We also both promote aging in place and have a vested interest in reducing any reliance on institutional care so that people can have the best quality of life possible for as long as possible. And we also both realize as organizations that assistive technology is a tool in that whole process. It's not necessarily something to replace services, but it is something that can be an addendum to services and help us be able to stretch, as we'll see a little bit later, caregiver resources, and then also be able to increase safety and confidence in the home and among family members, and just kind of provide a better sense of safety and security for all folks that are involved. So moving on to the next slide. And so while we have these commonalities, we also sort of come through this, and I think this might be true in other states as well, we come through this sort of from different lenses. We work on different sides of the system, but we are all working towards that same goal, and that same goal is to help Missourians live safely and independently for as long as possible. And again, I think that's probably something that all of us who are on this call today have in common, whether we're the Tech Act program or we're the state State Agency on Aging. Moving on to the next slide. Then I wanted to kind of highlight just a couple of partnerships, just kind of give a couple of examples of ways that we are working with entities across the state, starting with our state agency. And we have no formal partnership. And I think, and I don't know if this is unique to Missouri, some days I feel like it is, but we sort of have more of a partnership that would be akin to helping my neighbor down the road. And so I don't think we've ever had a formal partnership, but we have kind of been working in the aging arena and have had these conversations and been helping each other out, again, like we'll see here with the caregiver program. And so let's move on, and I'll give you a couple of examples of some of the things that we're doing here in Missouri. Starting with just the basic things. I mean, we all know that more people need to understand assistive technology and how it can benefit them in their lives. And so we do a lot of, as we have done presentations around the state, as we've provided other services, gotten more comfortable and have better networking with our aging network staff across the state, not only within state government, but within various organizations, and in particular with our area agencies on aging. That relationship and our name as being known to each other has enabled us to see an increase in referrals of individuals from the aging world to the assistive technology world. And that then leads to device demonstrations or them accessing the device reutilization program or doing problem solving to help them understand what types of technology are out there and how they can address various daily living challenges that individuals and families are encountering. And then if there is not something directly available out there, then we are also aware of some of those alternative solutions when services are limited, or maybe we can tap into a program we have to help them get that piece of assistive technology that can help them continue to live independently and safely. So if we move on to the next slide. We also do a lot of training and education, and we have had the pleasure over the years of presenting to various triple or area agencies on aging. There's a large aging conference every year called MA4, and I can think back to when we sort of began this journey, and in particular at the MA4 conference, we'd be lucky if we got a half dozen people in the room to listen to us talk about assistive technology, and now we've seen those numbers increase as the years have gone on. And so, considering getting out there, being able to provide training to area aging network staff just increases their capacity, their understanding of assistive technology, what we do, how our missions go together. And so we kind of cover everything from low tech to high tech, guidance on selecting and using devices, sort of try to break down some of the myths that we sometimes see around technology and what we're really talking about when we talk about assistive technology. So let's move on to the next slide. And this is an example of something we have been doing here in the last couple of years. And I'm going to give a shout out to Scout Mary on our staff. This kind of came out of his creativity. And what this was we are always trying to find intersection points, ways that we can engage people, we can get them more interested in assistive technology. And when we got our first 3D printer, I think that was about the time this idea got born. And then when we got our second 3D printer, it became a lot easier to do. And Scout is our 3D printing guru. But we created these a lot of, over the years, we've tried to have lots of discussions with individuals about low-tech pieces of assistive technology that can be useful on a day-to-day basis. And so Scout created, when we got the 3D printer, he started going down this road of creating lots of very simple, easy-to-use, low-tech devices like bag openers, bottle openers, nail clippers, bag carriers, all those types of low-tech devices. And created these kits and then basically buttonholed anybody he could find to have a discussion with about 3D printing, low-tech assistive technology. And we made these kits that you see over there on the right-hand side. He boxed them up in these nice colorful boxes and had these little guides that you see towards the bottom of the picture there. And then we sent these out. And so the idea there was that folks in particular area agencies on aging would share this information with individuals, and then if those individuals needed devices, then we would 3D print them and provide those devices to them. So it just gets that dialogue going. It helps people understand what we're talking about when we talk about assistive technology, and then just kind of leads to other things down the road. Now I'll turn it back over to Christina here to talk about what we've been doing the last couple of years, which is the Missouri Caregiver Program, which she referenced when she was talking a little bit earlier.
Thank you, David. And I will say, as someone who that also works directly with our AAAs, they love going to presentations from David and Scout and his crew when they're talking about assistive technology and these particular 3D printed items. They glowing reports. So they appreciate the whole idea of not all assistive technology has to be fancy and mechanical and cost a whole lot of money. And that kind of leads us into the Missouri Caregiver Partnership. Um, we have had a program existing here in Missouri for a number of years. It has changed shape several times, but it has always been to provide training and relief for caregivers of people living with dementia. And it is solely state funded and has had a couple of different paths for the funds to flow through. Track one is training, and that involves an in-home safety consultation. Someone comes in, looks what your setup is, has, what you have going on, what sort of supports you feel you most need as your person with dementia's disease progresses and things like that, and provides that training, that contact point, and then helps figure out if there are other services that they could benefit from. They get some right then, like point of contact assistive devices like grab bars and things like that often as well. And then if there are more items that are needed, then those get kind of passed on to the other tracks that we have. Track two is a relief piece that often includes a lot of respite care, whether that's in-home respite or adult day programs or temporary stays in a long-term care facility while, say, the caregiver is, has to have surgery or go out of town or something like that. And it also involves assistive some DME or other devices that would be supportive to the caregiver, keeping their person living with dementia safe and healthy in their home as long as possible. And it could be even like insurer or adult briefs or something like that as well. And then through that program, we were offering some assistive technology, but we wanted to expand that. And fortunately, we had funding from the state and were able to do so. We recently had a Alzheimer's state plan task force that has been very integral in advocating for more funds from the state legislature, and we received enough funding that we were able to expand this program quite a bit. And that is when we decided that we needed to bring in a partner who had the expertise to know what assistive technology folks needed and be able to explain how to use it and all of those things. Our contractor community asset builders initially started out doing those things themselves, but to be able to expand the program to the level that we needed, we were like, oh, hey, Mo AT is around. Let's see if this partnership could happen. So for the last couple of years, David and his team have kind of taken over a large piece of that, providing all those necessary assistive technology components for our participants in this program. And we have learned through the process that a lot of the devices initially, like with funding breakdowns and things like that, we were chunking a lot of money in that pot. And having David and his team really work with people to see what they needed, it came down to the fact that, these things that people are needing are not necessarily the most high-tech items, and they're not necessarily the most expensive items. And we can actually serve quite a few people for less money than we thought with by incorporating their expertise. So I actually just met with community asset builders this morning and got some updated data. So as of the end of February, almost 500 people have 500 families have been served in the assistive technology component, in that track 3 component of the Missouri Caregiver Program. And overall, that they've provided over 1,700 devices within that program. And so that it's all sorts of different things, whether they're cameras or things to monitor for eloping or falls or an assortment of different things. And they have really been able to lock down what the most common products are and be able to offer great training on the setup of those products and how to work with them. And David has been following up with folks to make sure that what they have is what they need, and if they need any additional supports in how to use the technology that they've received. And we have all sorts of glowing reports that have come through in about David and his team, and just the ability to utilize this program and what that has looked like. And we are just really grateful for the opportunity. The program is maxed out at this point as far as enrollment. We've had a lot of luck with referral partners and AAA's knowing about this program. The people in rural healthcare settings and things like that, we've gotten quite a few referrals directly from those. Someone's diagnosed with dementia, and now what do we do? And trying to get them into services like this early on, and so that it doesn't become like an emergency situation, and we can help walk with them through this journey. And MOAT has been an integral part of that, and we're glad to be a part of the team.
All right. Yes, this program has been honestly, in all the years I've been in assistive technology, the caregiver program has been a real eye opener for a variety of ways. And Christina, you did a great job of explaining it. And we sort of were building this plane as we were flying it when we started last year, but we're getting a little smarter as each day goes by. But the one thing in particular that I have learned, and I think that we have a little bit of a myth out there that we're still kind of dealing with, and that is that older Missourians, older Americans in general, I would say, are more tech savvy than we sometimes give them credit for. When we make these calls, when we get these referrals, I really feel like a lot of times folks have a really good, and we're talking people in their 60s, their 70s, and their 80s in some instances, and I feel like people have a really good understanding, sort of foundational understanding of assistive or of technology in general, which makes our ability to kind of walk through their situation so much easier, and it also makes that conversation about possible technology solutions that much more fruitful. And so this has been, we've learned a lot as we've gone through this program, and look forward to learning more and refining it as the years go on. So if we move on to the next slide, I know we're kind of getting a little bit up against time here. So if I was going to kind of summarize things, again, I kind of talked about how we sort of come from two different angles, but we sort of have all this commonality. So the aging network, they know the people. What do we do as a Tech Act program? We know the technology. So together, if we put the people and the tools together, we'll more successfully be able to match people with the tools they need to hit those goals that they want to achieve as they are aging. And so on the next slide, this is important. This is important for a lot of reasons, not just in Missouri, but from coast to coast. Our population is aging. I know in other states this is very true. We have this workforce shortage, and if we can use technology strategically, it helps us address that. And as Christina pointed out, collaborations, they can enable us to have a smarter use of funds, we can have a broader reach, and we can do a little bit quicker in terms of being able to solve those problems that people may be trying to address out there. And then on the last slide, just a kind of another broad statement about what we've learned, what we think here in Missouri, and that is that assistive technology is no longer optional in aging service. It is now essential infrastructure, and the caregiver program in particular has brought that screaming home to me on pretty much a daily basis. So I will hand it over to Aunt Andrea again, and thank you very much.
Thank you. Thank you, Christina and David. It's so great to hear the good things happening in Missouri. It's been a long time since I was in this world of aging and assistive technology, and I'm proud of my state. So let us go on now to the next wonderful state. We're very, very close to time, so I want to tell you, some of you have put questions in the Q&A function, and we are going to put those AI related questions on the agenda for another session because I think it is a bigger topic for us. So I want to introduce again Mike Shosey from North Dakota from the Assistive Technology program there, and also Nancy Nicholas Meyer, sorry. And you guys take it away. We're ready to hear about North Dakota.
All right. Good afternoon, everybody. Like she said, I'm Nancy Nicholas Meyer. I'm the Director of Adult and Aging Services in North Dakota. And I'll let Mike introduce himself real quick.
I'm Mike.
That was quick. Next slide.
Hey, we're in a hurry now.
So we are also the State Unit on Aging for the state of North Dakota, but we're also the AAA. So we are a single planning agency, meaning that we administer all the Older American Act funds. So they come into us and we're responsible to get those funds out. And some of the things that we're going to talk about today are funded through the Older Americans Act. We also, like many other states, have caregiver programs because we know they're really the backbone of the long-term care service and support industry. They provide the most care of anyone. We are responsible to protect vulnerable adults through our ombudsman program, adult protective services, and some work we do with guardianships. And then we are also the organization that serves older adults and adults with physical disability under our Medicaid waiver programs, Medicaid state plan personal care, and 2 state-funded programs. And we also administer money files to person. So we're kind of a catch-all, but in all of these areas, we've been really able to partner with Mike and his team. And so we'll be talking about that in just a minute. Next slide. So, sometimes we talk about all these programs, but how does somebody get access to them? And I know you just mentioned in Missouri that, the aging knows the people. And so we have a really robust aging and disability resource link is what we call it. But basically it's an intake system, an information and assistance system to help people access these services. And so if somebody calls and talks about a need, we can refer them directly to Mike's team and they can try to assist them in this area. So it's a big part of what we're doing in our state. Next slide. So as I mentioned, a lot of these things we're going to talk about today were funded under the Older Americans Act. I think you all probably know what that is, but it's based on age. There's no income limits. People can be asked to contribute, but there's no, they can't be denied for an unwillingness or an inability to contribute. And then it's a mix of those federal, state, and local funds. And because we are such a sparsely populated state, we get the minimum amount of services or funding from the Older Americans Act. So it makes partnerships and braiding money even more important. Next slide. So the next part of this, I'm going to have Mike talk a little bit about some of the initiatives that he is working on and partnering with us at Aging.
So the thing I would mention first and foremost is like this has all really been about relationships. And when Nancy has an idea, she'll come and say, Mike, what do you think of this? And when I have an idea, I'll go, Nancy, what do you think of this? And a lot of the work that you're going to see coming forward, and again, plenty of it was in place before I started, but some of the newer stuff has just happened through, oh my gosh, there's a need. How can we work together to solve it? And so that's been pretty amazing. And so we are one of the states, and I know there are other states dabbling and exploring in this, that dived into the capable program. And that's an evidence-based program where an occupational therapist, a nurse, and a handyman kind of get together to go into someone's home and figure out some strategies on how they can stay there for as long as possible. And the evidence-based was, tied to data collection. But what it really did over time was help us understand how important it was to get into people's homes and help them make the decisions that they need to do. And then there was money within Capable to help people acquire the devices and get some of the minor home mods done, which was a big difference maker. It's another thing to go in and say, hey, you could really do this, and this is a big need, and those sorts of things. But then having somebody follow through often becomes this huge, financial thing. I just flashed back, and I'm going to try to make this short, to a presentation we gave to a bunch of OTs at the college we have in town here. And we, started the presentation. A lady in the back raised her hands and she said, keep talking about home modifications. Well, we talked about redoing my mom and dad's bathroom, well, her grandparents' bathroom, and it was like $20,000. And I'm like, yeah, that's about 2 months in a nursing home. What do you think about that? And then immediately it was easy to shift that conversation with that group. So again, the money that was able to be put into those, helping people make decisions to get those devices. And then the other thing too is it snowballs, right? So if somebody gets one device and it works, then especially I think with this older population, they're more willing to get the next one. So that was the dive into Capable, and it has led to other potentially pretty amazing things.
Next slide. And I think, Mike, you were going to talk a little bit about the assistive safety, what you guys call senior safety, and then our telecommunications equipment distribution services.
Yep. So those, again, come from Aging Services Division. So Nancy has entrusted us to administer these programs for the state. Senior safety, I know Jeannie talks about this a lot. You've probably heard about it. But that's our program that we can get individuals trying to stay independent, living in their own home, who are 60 and older, free devices to help them stay there. One of the super cool things about the senior safety program is it's not tied directly to income. So people with income can qualify and get some of those devices. It does target rural and people who are at risk of nursing homes. So, we kind of get picky when we get short on money in a given month. You can see the list there of the types of devices that people get, but pretty much anything that we can tie to safety and keeping them in their homes. And you can see on the bottom, in fiscal year 2025, we served 183 people with 1,618 devices, which is awesome. And just kind of, because it's easier in my brain to think about that, we serve about 65 to 70 people a month with about 100 or so or more devices. It kind of stinks, of course, because there's just a given amount of money. And as these devices and the prices go up, we can get them fewer and fewer devices because of the cost of the devices that are out there. But we average about, $9,500 to $10,000 a month in devices. And then the TEDS program, many of you are well versed in the TEDS program, but we initiate that too at ND Assistive. Again, we only have that relationship because Aging Services trusts us with that. So, and again, at the bottom, you can see the numbers there. That's a 2-year grant for us. So about 400 people received about 650 devices last year, or last time we went counted.
Next slide.
And I'll just jump in here because this one was super fun. This kind of became one of our, everybody kind of has their COVID programs. This was one of our COVID money ideas. Jeannie was on board with this one and helped us write it. And we're just thrilled at the way it turned out and that people said yes. But we have a very large geographic state with very few people in it. And we were talking before we hopped on here, 800,000 is our entire population for our entire state, but we're big. So our ability to serve people from our, hubs in Bismarck and Fargo, which are the 2 largest population centers in the state, gets hard. And we're trying to figure out how to reach more people in more places. And so what we came up with is the idea of to create these kits of devices and get them in the hands of volunteers. And so there's about 20 or so devices in each kit. And we did find 25 people in the rural areas in North Dakota to house these kits. And they're tasked with, they can kind of do what they want with them within reason. But the idea is to just create awareness around AT in the smaller communities. And we really had this thought process about, it's one thing for us to come into a town of, 1,000 people, which by the way, isn't tiny in North Dakota. 1,000 people, we go to a show, we show them stuff, and then we're gone for 5 years. So we were like, how can we build relationships in those towns? So we believe finding people in those towns to advocate for AT is a really good thing. I can say that we did track some data, and of the 23 that are the kits that are still out there with ambassadors, every single one of them except one, we did see an increase in referrals, either demonstrations, our loan library referrals, or I did calculate senior safety applications and TEDS applications. So all those kind of bundled, and I tracked them. And then the only one that didn't see an increase, I'm like, okay, what happened there? Well, he had been using us forever and ever. So I'm like, okay, well that makes a lot of sense there. But the money expired on that quite a while ago. But once we got those kits into people's hands, they've just been happy to keep them. So this isn't going away, even though the money to get it started has ended.
Thanks, Mike. Next slide. I think this one's yours as well.
You want me to talk about the waiver stuff?
Well, just about what you do for the waiver. So we talked about where we also administer the Medicaid waiver, and Mike's team helps us in that area as well.
We've been doing in-home assessments, and that goes back 7-8 years before I started here. I asked Nancy if we could talk about, what are the things that North Dakota Assistive maybe isn't doing that you would like to see us doing. And the first thing she said was, we need people to go into homes. So we've been trying to build a way to do that. And our team has been slowly getting better and better and more on board with going into homes, doing assessments, writing reports, and helping people, stay in that way. The difficulty on our end was understanding how much time it took to really do a good job with that. And that was probably harder for me than it was for anybody else, because I'm like, okay, why is this taking so long? And so one day, one of our consultants, and she's an OT, she sent me a video recording of the assessment review she had. It's 2.5 hours long, and the questions, and honestly, like the mini therapy session that takes place with the humans that are dealing with so many things and their complex systems. And it really elevated the need for me, the need of this for me to see that. And We continue to do more and more, not only now with home and community-based waiver, but with our DD waiver in the state and much more with voc rehab too.
Yeah,
Because we're better at it now. Yeah.
Yeah, it's been a great partnership that's grown across the waivers, but it also gives us some assurance that the equipment is needed. It's based on a need. You know, they're going to be doing the training, and so you guys might recognize some of this language because I think Jeannie wrote it. I mean, basically, they got information. They gave us comments during our waiver and said should be your definition, and this is what you should do. And so it was really great feedback, and since then things have grown. So thanks, Jeannie, for that. Next slide. So why is it important to work with aging? I think all of you have said this in some form. You know, the older population is growing. The baby boomers are all going to be at least 65 years old in 2030. And so we're going to see growth in that population and also in the 85 plus population. And that's significant because you're often maybe need some support with ADLs or IDLs when you get to that age, or you might have a diagnosis of Alzheimer's disease. And so we just know that that population is becoming a larger portion of all of our states, and we're going to be challenged to meet those needs. Next slide. The other thing that we want to talk about is that AT, and I know some of you mentioned this, like it reduces the reliance on human intervention, or it can. It can also be used as a tool that could, you know, lower cost, right? So like if you buy a piece of equipment that allows someone to do it themselves, now we don't need that human intervention. And so the Administration for Community Living says that for those of us over the age of 65, about 7 in 10 of us are going to need long-term care for at least 5 years. And so you can see these are our state and federally funded home and community-based service programs and how long people stay on them. And we would like to keep people into the 5-year or less from a financial perspective, right? It's expensive. Care is expensive. And I think of the programs that we're doing with you know, Mike and his team are really prevention. And so if we can get two things to people when they first start to functionally decline because of age, we can serve them well for less money. And then maybe they won't need that really higher level of care until maybe, you know, later, really at the end of their life. So that's kind of how we've been approaching our services in our state. But next slide. So as Mike said, this is really about the relationships and just being able to kind of like be thought partners and bounce things off of each other and just try to figure out what we need to do. But as others have mentioned, it supports aging in place. It improves access and awareness of technology. People just really sometimes don't even have a clue, right, what this can do for them. It enhances care coordination. It matches a technology to an individual need, which is really important for like program integrity. People want to know, where's that equipment going, and is anybody using it, and why are you giving it to them in the first place? And that's where those like the OT assessments are important. And then it strengthens our workforce. It supplements caregivers, helps to relieve their burden. And it expands your community reach. So it improves access to rural and underserved areas if they can use equipment, you know, and they can maybe stay in their rural home instead of having to go somewhere else. And then it also just strengthens referral and outreach networks. So, you know, Mike can tell people about what we do, and we can tell people about what Mike does. So next slide. And this is just our contact information. If anybody has questions, we would be happy for you to send us an email or reach out to us in any way. I think that's it for North Dakota, Andrea.
Wonderful. Thank you, Mike. Thank you, Nancy. Great presentation. Really wonderful work happening in all of these states. And it's been great for us to hear a little more of the detail and some of the impacts that you're having, right, on older adults. So thank you so much. I am going to turn it over to Marty Exline, who's going to make a few announcements. Before I do that, I just want to say to all the panelists, all the presenters, thank you so much for being with us today, for giving us a sneak peek, a little peek at what you do. I feel like there are so many questions that may have come up for people that I hope folks do feel free to reach out to all of you and ask their questions. Thank you for the work that you do in your states. And thank you to those of you who joined us as participants. We hope that you got a lot out of this session. So with that, I'm going to turn it over to Marty for a few announcements.
Yeah, I just want to mention that the next session, the April Aging PAL, will be on April 8th, and it will be a 2 hour session, so it'll be from 3 o'clock to 5 o'clock Eastern time. So keep a note of that, and we'll be sending more information out. And just a reminder, if you do have assistive technology needs assessments or other documents, or want to engage in discussions about the PAL or something happening in your state, then you can do that at the AT3 community, and I've put the link into the chat, so don't forget about that. And we'll also post the report from last month's PAL into the community, the session we had on needs and barriers. So feel free to take a few minutes to look at that before next week's PAL. And other than that, just please complete. There'll be a post-session survey. I think it's one question popping up after we leave. So please just take a second and answer that question. And I think that's about it, Andrea.
All right, Jeannie, any final words from our hostess?
Oh, I just loved everybody's presentation. I learned so much, even from my own state that I worked in.
That's
So
great.
thank you, thank you, thank you.
All right. And again, if you have questions, reach out to the folks who presented today or to ATAP, and we'll put you in contact with folks who can answer your questions. Thank you all for participating. And don't forget, there's going to be a survey question popping up shortly. All right. Thank you, everyone.